means it ensures that health promotion programs are effective and contextualized.
Health promotion research guides policies.
Research protects rights and well-being.
Health promotion research empowers Filipinos to live healthier lives.
It helps us become better advocates.
It guides us why we do what we do.
The future is health promotion research.
Policy must be rooted in evidence produced by health promotion research.
Health equity begins with research.
Research empowers communities to thrive.
Is able to strengthen public health efforts.
Funding it means supporting informed health policy reforms.
Investing in research means investing in the future.
It ensures that health promotion programs are effective and contextualized.
Health promotion research guides policies.
Research protects rights and well-being.
Health promotion research empowers Filipinos to live healthier lives.
It helps us become better advocates.
It guides us why we do what we do.
The future is health promotion research.
Policy must be rooted in evidence produced by health promotion research.
Health equity begins with research.
Research empowers communities to thrive.
Is able to strengthen public health efforts.
Funding it means supporting informed health policy reforms.
Investing in research means investing in the future.
It ensures that health promotion programs are effective and contextualized.
Health promotion research guides policies.
Research protects rights and well-being.
Health promotion research empowers Filipinos to live healthier lives.
It helps us become better advocates.
It guides us why we do what we do.
The future is health promotion research.
Hey, good afternoon, everyone. Thank you for joining us today. So perhaps we can start with our online webinar. So good afternoon to everyone joining us today for our online panel discussion entitled For Every Generation, Vaccines Work, Protecting the Next Generation. I am Danika Bardelosa, the project manager of the UPLIFT Adolescents project, and I will be serving as your host for today's event. We are happy to hold this event in celebration of World Health Day, in support of Global Public Health Week, and in alignment with the World Immunization Week. Today, we examine the communication activities to promote HPV vaccination in school-based settings, local government units, and in partnership with young people. Before we start, we're reminding everyone that the views and opinions expressed in this webinar are those of the speakers and do not necessarily reflect the official stance of the Health Promotion Program, its affiliates, or its partners. And to maximize the limited time that we have together, please take note of the following house rules. Please keep your microphone muted unless asked to speak. Please message any of the organizers so you can see in our name. It's labeled as organizer. For any assistance with technical concerns, for any questions directed to the panelists, you may type them in the chat or reserve them during the Q&A portion. This webinar is also being recorded and live streamed on our social media platforms, particularly Facebook and YouTube. So by staying in the room, you consent to having your likeness to be recorded. Okay, so to formally start our event, Let's hear our opening remarks from Dr. Catherine Ann Reyes, Research Assistant Professor and Program Lead of the Health Promotion Program at the UP Manila National Institutes of Health. Dr. Cathy, the floor is yours.
Good morning, afternoon, and evening to our esteemed colleagues, health practitioners, youth leaders, and every participant joining us from across the Philippines and beyond. As the program lead of the Health Promotion Program and the principal investigator of the UPLIFT Adolescents project, it is my honor to welcome you to this panel discussion. We gather today to celebrate the Global Public Health Week, aligning with the World Immunization Week with our theme for every generation, vaccines work. The UPLIFT Adolescents project is called as such to encapsulate our aim in contributing to uplifting the lives of adolescents. So this is by empowering them and our communities in preventing the diseases that are caused by human papillomavirus. We need healthy adolescents who can thrive and lead in the future. By situating HPV vaccination within the broader context of equitable health system function, aligning resources from relevant programs, adolescent immunization, health promotion, and education, and looking beyond the vaccine and actually addressing behavioral and social drivers, we can be more confident that investment in an adolescent's health will be beneficial for them and the generations that follow them. While the science behind vaccines is settled, we recognize that the human element of healthcare is complex. As such, this webinar, wherein we will discuss, based on the presentations that will be done today, we will open space to listen to experiences and the nuances of how vaccines work in our society. And we will also follow in line with the WHO's objective to providing listeners today with knowledge that can support clear, compassionate communication around vaccination for adolescents. So we are privileged to be joined today by a powerhouse of our panel. So we have public health experts, we have clinicians, and we also have our youth advocates who speak the language of the population we serve. So as we begin, I challenge each of you to participate actively, use the chat, ask questions, and you may also share experiences that you think will be relevant to our overall learning. So your insights today will shape how our project, the UPLIFT Adolescents Project, will continue to contribute in strengthening vaccine uptake across schools and communities in the Philippines. So let us remember that vaccines work for every generation, but they work best when we work together. So let me take this opportunity to thank the WHO Alliance for Health Policy and Systems Research for supporting this project, and also to my colleagues who worked tirelessly in putting this webinar together. Without further ado, I formally open this panel discussion. Let's build a future that is protected, informed, and resilient. Welcome to the UPLIFT Adolescents Project webinar.
Maraming salamat po, Doc Cathy. It is indeed the powerhouse of speakers that we have for today's webinar, and we're excited to introduce them later today. But before that, we are also honored with a special message from Dr. Aku Kwame, the lead for strengthening capacities, institutions, and methods at the World Health Organization Alliance for Health Policy and Systems Research. Please watch this recorded message she sent in for today's event.
Good afternoon, friends and colleagues. I bring you greetings from Geneva and from the Alliance for Health Policy and Systems Research, and I'm delighted to have the opportunity to address you today as part of UPLIFT Adolescents panel discussion. We're here because HPV vaccination has become a triple threat priority in global public health. In 2026, it's the cornerstone of WHO's 90-70-90 global strategy, which aims by 2030 to have 90% of girls vaccinated by the age of 15 to prevent the estimated 350,000 annual deaths from cervical cancer. But this isn't just a clinical goal. It's also an economic investment. For every dollar we invest in prevention, we see a 26-fold return in workforce participation and averted costs. Our focus has shifted from mere availability to equity, ensuring that the single-dose vaccine reaches the regions where the bulk of cervical cancer deaths still occur. Why is the Alliance funding research in 6 countries, including in the Philippines? Because we know that immunization is the success story of the 20th century, yet the 21st century has brought new challenges. Since the COVID-19 pandemic, vaccine hesitancy has grown even more complex. Most vaccine studies look only at the individual, at the parent or at the child. But at the Alliance, we look at the system. We look at how health and non-health actors organize themselves. And out of 101 global proposals that we received, the UPLIFT team was selected as one of 6 country teams because you chose to look at the holistic perspective. You recognize that in the Western Pacific region, it shows the greatest disparity in HPV coverage globally. And in the Philippines, cervical cancer is the second most common cancer amongst women aged 15 to 44. You understood that addressing this need requires more than a vaccine. It requires policy shifts and deep engagement with parents and schools, local government units, faith-based groups, healthcare workers, and youth themselves. And so this brings us to our theme for every generation, vaccines work. I'm reminded that when we brought together the 6 country teams to Geneva in 2024, we collectively developed a metaphor that stays with me. We spoke of a mighty tree. We imagined a small seed planted in fertile soil. At first, its roots were fragile, struggling against the weeds of fragmented knowledge and unpredictable policy landscapes. But through your research, fueled by stakeholder insights and adaptive learning, that sapling is growing. And when I visited you last October, I saw the fertile soil of the Filipino context for myself. I saw that HPV, the immunization story, is not just about vaccine. It's a complex interplay between the individual and the institutional, between history and geography, between expert opinion and lived experience. It's about the wisdom of elders and the energy of youth. It's about the willingness of a carer and the ability of local services to deliver. And we understand now that this work is not just about excellent research. It's about building relationships, building trust, and building communication. Developing key messages that can speak to the diversity of actors who have a stake in HPV, in language, and with values. This is core to moving knowledge into action. The UPLIFT Adolescent project is asking a vital question in 2026. What is adolescent health? It's recognizing that protecting an adolescent today preserves the future of an entire family tree tomorrow. 2026 can be a turning point. The progress we make now will set the trajectory for decades to come. Information, advocacy, and action are needed now more than ever. Let's make sure that this sapling continues to grow, that its branches and leaves cover every boy and every girl in this generation, for every generation. Vaccines work. Thank you.
Thank you, Dr. Kwame, especially for emphasizing the work that HPP UPLIFT Adolescents project team does on adolescent health. We very much agree that right now, is a pivotal period where we see both national and local level policy and program actors kickstart these important dialogues on vaccine strengthening. And we hope that this webinar can be an instrument for that as well. So I think before we proceed with the formal program, we want to hear from you. We want to hear your thoughts. So please join us in our Zoom call and let us know your answers to these three important questions that we identified for today's event. So first, have you or someone you know have been vaccinated with HPV vaccine? You can answer by either yes or no. Second, where did you first hear or read about the HPV vaccine? So it can be from a friend, from a family member, a health worker, radio or TV, from social media or other platforms. And lastly, where else do you want to hear or read about HPV vaccine information? So aside from those that where you've heard the HPV vaccine about, where else do you want for this to be accessible in terms of accessing this information? Since we're talking about HPV vaccine communication strategies and initiatives, this would be a great springboard for our discussion today. You have the option to send in your votes through the Zoom platform through this call, or for those joining us via live stream can send in their answers through the comment sections, either via Facebook or YouTube. We can't wait to learn more about your answers, and maybe we can loop it into our insights that we will be sharing later today. So right now I can see majority have heard about HPV vaccine, so that's 69% out of 39 who have responded so far. And most have heard about the HPV vaccine from a healthcare provider or from social media platform. So perhaps you can type it in the chat box kung anong social media platforms po ito. Is it via Facebook, Twitter, or X na pala ngayon, YouTube, from TikTok? And then is there any particular Facebook or official page that you can mention as well? So we can take note of that. So aside from those that the respondents have mentioned, they also would like to hear more about HPV vaccine information from a healthcare provider specifically, and also from social media. So mukhang patok na patok po ang social media pa rin, no? Now that we're in the digital age. And of course, the healthcare providers as the ones as the primary source of information as well. Okay, so we have 43 responses so far. Perhaps we can end the call for now. We can share a little bit more about the results. Thank you everyone for joining our interactive session. We can now proceed to a presentation to be delivered by Ms. Krizelle Cleo Fowler, co-lead of the UPLIFT Adolescents project. She'll give us the insights on the project and the backgrounder on the HPV vaccination in the country. Krizelle?
Hello po, good afternoon. I'm Krizelle Fowler. I'm a senior program researcher of the Health Promotion Program and also a co-principal investigator of the UPLIFT Adolescents project. So to give you an overview and to also reiterate po yung sinabi ni Dr. Aku Kwame kanina, this is actually one of the 6 projects across the world studying how vaccination across different age groups, be it adolescents, adults, or even infants, how do they access vaccine and what affects a person to get or decide to get that vaccine. This specific project po it looks at at health policy and systems research. It's a it's a special type of research where you're not only just estimating kung ilan yung nabakunahan or ilan yung hindi pa nababakunahan, but looking at the reasons behind why those statistics are happening at the individual level, at the community level, at the policy level, at the national level. So it gives emphasis that health should be looked at more holistically or more systematically, that we need to emphasize that there are a lot of other factors that drives us on how we access or how we decide to get our health services. In this project, we have 5 specific objectives. Una po ay gusto naming malaman ano ba yung mga community level initiatives na meron for HPV across the sites that we are studying. We want to explore the behavioral and social drivers of why parents or caregivers decide to get their children vaccinated. We also wanted to hear the lived experiences of adolescents and the perspectives of the providers working in the HPV landscape, and also the teachers or the schools themselves that are a gateway in HPV vaccination. After that po, we want to develop and pilot an intervention that integrates all of the knowledge that we have co-generated with our stakeholders, and also help them create an monitoring and evaluation framework that they can use when they sustain the intervention that we have co-created with them. Along the whole process of this project, we also want to engage communities and even stakeholders like yourself to support the uptake and translation of the research that we do. In this po, we want to give importance that the findings that we will be sharing today are for the purposes of getting your insights as well, so that we may improve the evidence that we generate and also inform the research that we are still doing across the next few months. Ito po yung study design. So essentially, we are in phase 2. We are now in the program theory refinement, or the phase where we will develop an intervention with our community stakeholders. During phase 1, we conducted our community profiling and assets mapping. Inilista namin ano bang meron at wala sa bawat komunidad. Nag-survey po kami sa mga caregivers para tignan ano po ba yung nag-drive sa kanila para kumuha or hindi kumuha ng bakuna para sa mga adolescents natin. And we also did a review of existing literature online, kung ano na po ba yung ginawa sa ibang bansa at paano po kaya natin yun ma-apply para sa atin sa Pilipinas. At phase 3, ito na po yung phase where we will implement an intervention that we co-designed with the stakeholders, and phase 4 is the monitoring and evaluation framework. Across this whole project, we have this desired impact pathway. By knowing what the community have and by knowing their behavioral and social drivers, and also co-developing an intervention that they can own, that they have ownership and accountability, we hope to improve HPV vaccination coverage across these sites and hopefully inform national level initiatives on HPV-related interventions. In our study, meron po kaming 4 sites. In Metro Manila, we have Manila City and Mandaluyong City. In Region 4A or Calabarzon, we chose Antipolo City and Los Baños. Baka po nagtataka kayo, no, bakit sila? So ito po yung mga kinonsider po namin ay yung performance ng sites na ito in terms of HPV vaccination. Kung marami po ba nagpapabakuna, kung marami po bang eligible magpabakuna pero masyadong mababa yung number or proportion ng mga batang pumipiling magpabakuna. Ano po ba yung ginagawa nila in these sites? Meron po ba silang related intervention with HPV, and kung sino po yung may strong local commitment? If makikita po natin kanina, no, meron kaming 4 phases, and it's very important na meron po kaming suporta ng mga communities dahil it's a 2-year project and we won't be able to progress if we don't have their support. Ito po yung study conceptual framework of the UPLIFT Adolescents. Essentially, it just reinforces na at the individual level, meron tayong na iisip, nararamdaman. Meron tayong motivation to get the vaccines. We have interaction with our families, with our health workers. However, that is just at the micro level. Isang part lang siya kung bakit tayo nagdedesisyon magpabakuna. Meron tayong mga community and local social determinants na tinatawag. For example, in terms of counselor, meron ba tayong kagawad na sumusuporta sa pagpabakuna? Meron din tayong practical issues. Available ba yung bakuna sa community health center? Meron din tayong national and political governance. At the national level, nagbibigay ba ang gobyerno ng bakuna para sa mga komunidad na to? So all of these factors actually shape whether we decide to get the vaccine and whether or not we are able to get the vaccine. So for phase 1A, ito po yung community profiling. We use a framework from the World Health Organization. We use both online sources and local data sources, and we validated this with our healthcare workers and other representatives in the LGUs. Pag sinabi po nating WHO building blocks, meron tayong leadership and governance, financing, medical technologies, human resources for health, information system, and service delivery. Pinapakita ko po ngayon dito yung 5 muna. In terms of leadership and governance, nakita natin na across 4 sites, may iba't ibang level of commitment on HPV vaccination. Hindi lahat or very limited yung LGU champions natin like counselors na sumusuporta sa ordinances around adolescent health, HPV vaccination, cervical cancer, and more often than not, ang kalusugan po ay hindi nasa top priority ng isang LGU. For financing, karamihan po ng bakuna, actually, halos lahat ng bakuna ay nanggagaling sa national level. So, kung anong ibababa sa regional, ayun din yung bababa sa communities. And meron po tayong tinatawag na GAD funds na nakita natin na hindi pa siya masyadong ni-utilize or ginagamit para sa HPV vaccine. Currently, kahit meron tayong PhilHealth, hindi pa na-experience ng mga LGU natin na gamitin yun or i-leverage siya for HPV vaccine specifically. In terms of capacity to store vaccines, meron naman po ang mga komunidad na to ng capability to store these vaccines, and ang nangyayari lang po is kahit na meron silang bakuna, since onti yung nagpapabakuna, they have no choice but to give it back to the regional level or decide on how they can distribute it sa ibang constituents ng city na yon. So, siguro po refresher lang na ang HPV vaccine natin ay ibinibigay primarily among grade 5 students for public schools. So, ang prioritization po natin ay nasa public school. Kung hindi po siya maubos sa public school, tsaka po siya in-open for uptake sa private schools or sa health facilities natin. In terms of human resources for health, nakita natin across 4 sites na iba-iba po yung capacity ng mga LGUs, and more often than not, alam naman po natin na ang nurse natin or mga doktor natin, marami po silang responsibilities na ginagawa at wala po talagang specific na tao na nagbabantay ng HPV vaccination, and it's a reality for a country like the Philippines. In terms of health information systems, nare-report naman po kung ilan ba ang bakunang nagagamit locally. Ang problem lang po, since nagkakaroon tayo ng iba't ibang way on how to distribute the vaccine, sometimes there are barriers in reconciling ilan ba talaga yung nabigay para sa public schools or sa other modes of delivery. In terms of community engagement, meron naman po tayong civil society organizations na present sa mga LGUs, but then again, wala pong specific na organization or grupo na talagang tumatalakay sa HPV or adolescent health. In terms of service delivery, nakita po namin na since ang HPV vaccination ay binibigay primarily sa mga eskwelahan, ang mga komunidad din po or mga LGUs natin ay nagko-conduct din ng facility-based. Focusing more on the school-based immunization, nakita namin na may potential dropout po sa pagbibigay ng consent form sa mga magulang. Nakapagkabigay ng consent form, possible na hindi na bumabalik yung, or hindi na binabalik ng mga magulang or ng mga bata yung mga nagde-decide na wag kumuha ng bakuna. Nakita po namin na very important ito kasi hindi natin malaman bakit hindi nila binabalik. Dahil ba nawala ng bata? Dahil ba nawala ng magulang? Dahil ba nakalimutan lang sa bahay? Or talagang ayaw nilang magpabakuna? And you will see later on kung bakit napaka-importanting maintindihan yung reason on why these consent forms, which is parang yun po yung susi Kapag hindi nagbigay ng consent form ang bata, hindi na sila mababakunahan on the day itself. So it's an important key for them to access the service. So yun po yung phase 1A na community profiling. Meron din po kaming sinagawang survey across 285 LGU constituents across the 4 sites. Nakita po natin na mataas naman po ang tiwala ng mga caregivers ng 9 to 14 adolescent females sa bakuna. That's 95.8%. And mataas din po yung awareness nila, around 79%. Pero kung titignan, and good thing din na 65.9% of them are aware or concerned about the perceived risk of not getting vaccinated. So, ang example po ng risk na yan ay cervical cancer, and makita po natin na high trust, high awareness, pero nung tinanong na kung ilan ba talaga yung nabakunahan na bata sa across those 285, nakita natin na 65% lang, or less than 65, around 64.9%. And if titignan naman natin yung mga hindi nabakunahan, 58% lang yung nagsabi na gusto nilang mabakunahan yung anak nila. So malaki po yun na ang target po natin ay nasa 90%, pero nasa 65 pa lang tayo ngayon, and kapag tinanong naman natin yung hindi pa napapabakunahan, around half of them only said that they want to get vaccinated. So, tinry naming aralin, ano kaya yung rason kung bakit onti lang yung gusto magpabakuna. So, sabi naman nila, they have high confidence in the vaccines, merong moderate awareness ng HPV vaccine bago yung survey. They have 83% of them, sabi naman, they have moderate to very high perceived safety of the vaccine. More than half of them alam kung saan kukuha ng vaccine. 59% of them naka-receive ng recommendation sa health worker. Pero dito na po makikita natin na may ibang factors pang nagda-drive for them to decide to get the vaccine. Less than half of them, sinabi po na madali ang pagkuha ng bakuna. Less than half of them, or more than half of them, hindi alam na libre palang bakuna sa schools. Tapos 33% of them said that only 33% of them said na they are supported by their family when they decide to get the HPV vaccine. So, yung makikita niyo po sa baba, ito naman po yung mga dapat sanang mag-enable sa kanila, no? Ito yung mga challenges kung bakit hindi nila kinukuha yung bakuna. So, 82% of them, so that's around 4 na magulang sa kada 5 na sinasabi na meron silang specific concern about sa bakuna. And when we explore this, it's usually on the ingredients of the bakuna. Hindi nila alam kung ano ba yung laman ng bakuna, and doon sila natatakot. In terms of getting access to information, sinabi naman nila na 62% ay hindi nakatanggap ng kahit anong information from the health authorities, and even a larger proportion of them reported na hindi sila nakakuha ng information on HPV from the schools. So, mas pinalalim po namin yung pag-iintindi dun sa survey na yon. So, we conducted KIIs and FGDs, and ito po yung mga nakita naming drivers and enablers or barriers sa pagkuha ng vaccine. So, enabler natin, alam natin na meron na silang mataas na awareness tungkol sa HPV, sa cancer risk, sa bakuna. Meron silang mga information channel na pwede i-access sa school, sa health center, sa community. Kapag nasa school base, at least hindi na nila kailangan pumunta sa mga clinic kasi nandun na mismo, ino-offer na agad sa mga bata. Malaking factor din yung peer influence. Nung nag-interview po kami ng mga bata, sinabi nila na kapag yung best friend nila nagpabakuna, mas likely din sila na sabihin sa magulang nila na magpapabakuna sila. They also noted yung health system adaptability. So yung mga healthcare workers natin talagang tinatry na ma-achieve yung targets kung hindi man available sa school. For example, itatry na i-offer sa communities para mas madaming makapag-access ng service. And nakita po namin na yung mga teachers natin, yung mga community leaders natin like Kagawad, or even our health workers, they still have the potential to encourage HPV vaccination. On the other hand, yung mga nakita po nating barriers are merong mga unmet needs yung caregivers natin. Meron silang mga emotional concerns na gusto munang ma-address bago nila piliin magpabakuna. They also see that the low confidence and the limited interaction with healthcare workers hinders them from choosing to get their children vaccinated. Minsan, meron din tayong practical constraints na hindi pwede si mommy or wala yung bata, nagkasakit. So, hindi na nila ma-access yung bakuna. And meron din tayong national level concerns like kapag walang binababang bakuna from the national level, hindi makakapagsagawa ng vaccination. And yung capacity ng influencers natin, teachers, leaders, it's very passive since they themselves have limited knowledge or experience working in the HPV landscape. So that's actually a critical gap na gusto sana nating ma-address later on. So ito lang po yung summary ng ating phase 1 and phase 1A and phase 1B na meron tayong information and awareness gap. So alam mo kung saan kukuha ng bakuna, alam mo kung para saan siya, pero you don't access it. Health-seeking behavior is still low. Meron tayong untapped potential from the different influencers in our communities. Meron tayong gap sa consent form, and there's still a potential to integrate HPV vaccination with other programs like nutrition, SRH, etc. Yung last phase po ng phase 1 ay sa realist review. So ito po yung kapag pag-aaral namin ng ibang studies across the world. And we found 4 countries similar to the Philippines, Uganda, Rwanda, Togo, and Malaysia. And dun po namin nakita na in their countries, dalawang factor po yung nakita nilang nag-affect or nag-improve ng kanilang HPV vaccination. Una ay yung pagkakaroon ng citywide advertisement, educational week and parent meetings. So it's a very multi-sectoral approach to HPV vaccine. Hindi porket dinedeliver siya sa school ay doon na natatapos. Dapat meron talagang mas community-wide support and participation. Nakita din natin na in-integrate yung HPV vaccination to other services like WASH or SRH, and napaka-importante din po ng collaboration across the different schools, the different sectors in the community. So all of this information po was derived from the expertise, the support, the resources from our stakeholders, and I just want to take this time to acknowledge everyone who has helped us shape the phase 1 result that will further build on the next phase of the project. So again, maraming salamat po sa WHO, sa DOH, sa ating LGUs, and sa ating sa civil societies, and of course, our Project Advisory Committee from the University of the Philippines, Manila. So that's it for my presentation. Magandang hapon po ulit.
Salamat, Krizelle, for that comprehensive project overview. Through this presentation, we hope that the participants today have a better appreciation of how we at UPLIFT Adolescents Project attempt to address the HPV vaccination challenges in the Philippines at a holistic point of view. So attendance check po muna tayo before we move to the next session. We're now at 76 participants and more. So maraming salamat po for those 76 participants here in Zoom, and perhaps many more on YouTube live stream for taking interest in this topic, particularly on HPV vaccination strengthening in the Philippines. So moving forward to our panel discussion proper, I have the privilege of hosting our panel of experts and also have the privilege of introducing each one. For our first panelist, we have Dr. Miguel Angelo Mantaring, or Dr. Migo as he is known. Dr. Migo graduated from the University of the Philippines College of Medicine in 2016 and served as Municipal Health Officer of Itbayat, Batanes under the Doctor to the Barrios program. He later joined the Department of Health Promotion Bureau, where he became Chief of Program Management and Capacity Development Division and led the rollout of major initiatives such as the Healthy Communities Program, Health Promotion Playbooks, which were rolled out across 83 provinces and cities, Healthy Learning Institutions, which was rolled out across 788 schools, and the Wellness Movement Program, which was implemented among 121 hospitals and among 11,000 healthcare workers. Dr. Migo now serves as the Director 4 of the Bureau of Learner Support Services at the Department of Education, leading efforts in school health, sports, and youth formation with a focus on promoting early health and wellness to support better learning outcomes. His work is driven by the belief that addressing inequities in the health through the lens of its social determinants is essential to shaping more productive Filipinos and fostering a brighter future for the country. A lesson deeply rooted in his public health experience and his time serving in various positions. Next, we have Dr. Alvin Isidoro, a multi-term municipal health officer of Los Baños and a decorated rural health physician and pediatrician. Dr. Alvin Isidoro is a dedicated medical professional with a strong background in public health and pediatric care. He earned his Bachelor of Science in Zoology from the University of the East, Manila, and completed his Doctor of Medicine degree at the University of East Ramon Magsaysay Memorial Medical Center. A fellow of the Philippine Pediatric Society, Dr. Isidoro has demonstrated excellence and commitment in the field of pediatrics. Since 2006, he has been serving as the Municipal Health Officer of the Municipality of Los Baños, where he continues to lead and implement health programs that promote the well-being of the community and aims to provide accessible, affordable, and sustainable quality health services to the constituents of Los Baños. And last but not the least, we have Subingsubing. Subingsubing is a strategist, storyteller, change maker who thrives on transforming complexity into compelling, purpose-driven campaigns. As a managing partner at Evident Integrated Marketing and PR, she drives award-winning advocacy and behavior change initiatives across health, education, women's economic empowerment, workforce development, and environmental sustainability. With a deep passion for employee engagement, company culture, innovation, and operations, she fosters environments where both people and ideas flourish. Guided by her purpose to inspire positive change through strategic thinking, creativity, and empathy, she aligns her love for learning, mentoring, and communication with efforts that shape a world valuing biodiversity, sustainable development, and collective well-being. So those are our panelists for today. Now that we've gotten to know our panelists, let me ask our first question. So this question is addressed to Dr. Isidoro. Dr. Alvin, what are the most common sources of vaccine hesitancy or miscommunication that you encounter within your municipality?
Good afternoon. Is my audio okay?
Yes po.
Thank you. So good afternoon. First of all, I'd like to thank the organizer for inviting me here in the forum. Is it true that I cannot speak Tagalog? Do we have foreign participant? No. Okay. Okay. So the question is, what are the common vaccine hesitancy encountered in the community? Well, first, just a brief background. In 2011, we had the Mother-Daughter Initiative in Los Baños. That is a project of SICAP Philippines and Japaigo, wherein we vaccinated around 1,000 girls, 1,000 female, aged 9 to 13 years old. And this is in partnership with, this is in side by side with cervical cancer screening. Well, during the time, HPV vaccine was relatively new in the Philippines. I don't know if that's true, but in our community, that's relatively new. The vaccine hesitancy during the time, well, first it came from us, the health worker, because there were issues on, since the vaccine is new to us, the issue is on the safety. Is it safe? Is it effective? And the fact that the project is being done in only 3 communities like Los Baños, in Cebu, and Manila, and I think Pagbilao. That makes us also hesitant to invite participants. But because of the data during the time that the cervical cancer is really associated with human papillomavirus infection, then we went ahead and went full blast with the project. But of course, there were for sometimes there were really hesitancy among the midwives, the nurses, the barangay health workers in promoting or in recruiting the participant for the vaccination. But then again, that project became successful. We reached I think the 1,000 target of vaccines. Now, other than the health workers, the parents were also hesitant during the time because, well, the concern on safety, is it necessary? It is always the question is it necessary? During the time, they will ask, kung anak namin is 9 years old, 10 years old, they're not engaged sexually, they're not sexually active, do they need the vaccine? So it's the usual question. Then there's a question of what are the long-term effects? Then if ever they already consented on the vaccination, sometimes other relatives will object on the vaccination. So those were some of the reasons for vaccine hesitancy. Then, of course, for the recipient, the children or the girls 9 to 13 years old, of course, ang pinaka cause of hesitancy is the fear of the vaccination. Then sometimes on the schedule of the vaccination and the geographical location of geographic location of the project. Sometimes we recruit participants coming from far-flung areas, so those were the reasons why they do not join. Now, at present, 2026, almost more than decades after we first started this vaccination, would you believe that hesitancy in vaccination is still coming from us, the health worker? Why? Because of different reasons now. One is, and most important, is the availability of vaccine. Sometimes we are not that, we are hesitant to promote HPV vaccination because it is not readily available in our health facilities. So when you promote this vaccination and the parent asks you, is it available in the center? Then you will say no. Or the supply is not is limited. So those really are the problems that or the challenges that we have. So that most of our health workers are not that um, intense in promoting the vaccination. Like for example, um, um, our target population of 9 to 14 years old girls are about 10,000. And last year, we only received around 400 doses of HPV vaccine. So that's 400 doses of vaccine divided by 2, that's around 200 girls. So that's roughly less than 6% that we will be vaccinating. So anyway, the hesitancy among parents are lesser now, but for us, the health workers, those really are the challenges that we encounter. We are hesitant to promote actively because we know that our supply is limited on the HPV vaccination. Thank you.
Thank you, Doc Alvin, and also for covering the aspect of the supplier side as well as the end user side. No? So it seems that there are pressing issues on both aspects of the demand and supply. So very similar to our findings from Uplift Adolescents project. The next question is for Dr. Migo Mantaring. So from your experience in DepEd and perhaps from your experience from the Health Promotion Bureau, how is the HPV vaccination communicated to adolescents in school-based settings? And what are the strategies that have been employed by the Department of Health?
Okay, but siguro, first of all, thank you for inviting us in the Department of Education to share in the advocacy of promoting HPV vaccination, especially for our learners. We acknowledge that this is really a critical investment that we need to strengthen, and it will save a lot of lives, and especially in our mission of making sure that our learners will be ready for the next phase of life. No, this is something that we highly value. So you mentioned my previous work in the Department of Health, no, and I think it was good how the health promotion framework strategy identified immunization as one of the key behavioral priorities in addressing a lot of the causes of morbidity and mortality among Filipinos. And communicating this in a settings-based approach was one of the strategies and interventions that the DOH led. Now, in the Department of Education, we're carrying that through and carrying it over, making sure that how we communicate immunization, not just HPV, no, but the entire health portfolio of how we are ensuring the parents of our learners that we are here to take care of their children is packaged in a way that in how we deliver our learner support services. So it's really packaging all of these health and well-being interventions into a comprehensive learner support framework and learner support communication strategy, so that it doesn't become programmatic and focused on specific risks, which when taken in silo might detract from its uptake, no, in schools and for parents to consent to. So now moving into this coming school year 26 to 27, which begins in June, we're really strengthening, no, how learner support is essential for our learners, and especially for health, no, we're institutionalizing and strengthening the full range of school health services, which includes assessments, as well as the preventive services like immunization that is delivered to our learners. So in that process, no, we ride on a multi-level and a big system that we have to integrate all of these key messages and platforms to engage with the primary decision makers for these school health services. So in this coming school year, we will continue to implement our learner health assessment and screening, which capitalizes on the parents in the beginning of the school year during Brigada Escuela. It's not just simply about preparing the school environment, but it's also about preparing the learners as well. So we're trying to mobilize a whole of community approach so that a lot of the barriers or the sources of hesitancy can be addressed then and there while the parents are in school and enrolling their learners for the coming school year. So the process of obtaining consent is streamlined and packaged na at the beginning of the school year, this is what you will expect to receive from your from the school, no, as part of our care, our, as part of assessment, vision screening, and several services like school-based feeding, and that's where school-based immunization comes in. So we package it as one. We package it as a comprehensive set of school health services and learner support interventions, which we hope will be appreciated more comprehensively and more in a more integrated fashion. With that, no, there are several other mechanisms that we mobilize, like one being our parent teacher association meetings. So we want to also strengthen how we can maximize PTA meetings to deliver the benefits of health interventions delivered to the learners during the entire school year, which will include school-based immunization. We also want to mobilize homeroom guidance as a platform for allowing our teachers to talk about the benefits of taking care of your health, seeking help from professionals, no, and supporting your peers in a lot of the problem approach. So we're mobilizing a lot of peer navigators, which we capacitate so that they know and support each other to link them to adolescent-friendly facilities for any of their needs, because they will be the most trusted sources of information amongst each other. So having said that, there are a lot of platforms, no, and systems in place within the education sector that we're trying to insert integration points for how to deliver vaccine communication messages, and looking into how process-wise it can also be integrated into platforms where the parents will be engaged directly with our health professionals within them.
Salamat po, Dr. Migo, for that very comprehensive overview of how DepEd has been doing or addressing the HPV vaccination strengthening in the Philippines. So as a follow-up question lang po, what are the current capacities and challenges in communicating sensitive topics like HPV and adolescent health in school setting that you have experienced so far?
Yes, again, I think thanks for that question. So siguro I'll start with the capacities. No, so I think it's not a well-known fact that DepEd has we have our own set of health personnel within our schools divisions offices. So that's an existing capacity that I guess we're not purely educators, but we're also public health practitioners in that sense. Kasi we're here really to make sure na our learners are in a good state of health and well-being. So with that, with our complement of health personnel within DepEd, we're able to implement a lot of the programs, no, given our professional backgrounds, which includes the medical, dental, and nursing services program under our flagship health programs. No, A lot of our capacities will also be linked to our close coordination and collaboration with DOH, who oversees the delivery of public health services and primary care services together with local government units. So there are several platforms at the national level where we are able to communicate challenges and come up with strategic collaboration points for how we can continuously deliver school health services or school-based services. No, when it comes to challenges, no, I think similar to what Dr. Alvin mentioned, there is still a felt uh, prevalence of stigma when it comes to immunization, especially to some parents. No, so the sensitivity also of HPV in the context of sexual and reproductive health, it's not something that we're still fully embracing as a commonly talked about topic. No, so we're trying to build that capacity as well to make it easier for these types of discussions to occur, both inside the classroom and outside the classroom, but within the school. So and the large capacity, even though I did mention that we do have health personnel in DepEd, it's still a limited number. So we really need to expand, no, how we work collaboratively with local governments, with the DOH, with the healthcare system, no, so that it's targeted as a whole of community approach to tackling this issue. And with that, no, not all of our health personnel will be at the same level of competency when talking about these common issues amongst our learners. So that's really something that we also want to address moving forward, so that they are also confident and competent to talk about a lot of the misconceptions and disinformation related to vaccination.
Salamat po, Dr. Mio, for answering that. So moving to Dov, so with your experience in terms of communications and advocacy, what strategies have been proven effective in engaging adolescents and sustaining their interest and trust in health communication initiatives, especially on sensitive topics like this?
All right, sige. Thank you, Danica, and good afternoon, everyone. So, yun, coming also from the perspective, no, of communications and advocacy. So, actually, ang ganda na rin nung shinare nila Doc Alvin and ni Doc Migo, no, about how parang ano yung challenges, and then also yung parang what is the ideal enabling environment, no, particularly in schools, and sino yung mga key stakeholders that we need to engage. So and of course, ano nga ba yung ultimately, no, from the at the communications and behavior change level, 'di ba, of campaigning, no, for vaccine HPV vaccine uptake. So ang ultimate goal natin in comms is really building trust and building confidence, no. So on a lot of different levels. So ultimately, building trust so that they get the vaccine or get immunized. Pero before you get there, di ba, ang daming levels niyan eh. Yung first, you have to supply them with the information, and you assume that, di ba, the information that they get are factual, reliable, and makes them feel comfortable. And how do you do that, di ba? And from getting it through, di ba, reliable stakeholders or stakeholders that they trust. Because otherwise, the opposite of that is that they'll spiral into, increased feeling of risk and ultimately fear, which will deter us from our goals. So sa amin, in evident, it's always, of course, building towards trust, and how we build this is also through relational consistency, no, in our stakeholders, in the message, and then in the content that we produce. And not just while the message is important, it's the how also, 'di ba? Na pinagtutuunan din namin ng pansin in evidence. So particularly a campaign or a communications activity has to be relatable and reflective of particularly the youth's what is resonant with them. So what we know, and based on our experience also know with working on campaigns that benefit and also involve the youth. So what we've learned from them is definitely they prefer receiving health information, diba, through a lot of definitely they're very young, no, and they embrace a lot of social content, digital natives ang karamihan ng kabataan. And so that's where it's very natural to them to receive information from social media. But at the same time, 'di ba, yung challenge nga natin and with the 'di ba, the issues of infodemic, misinformation and disinformation. So it can be there's a fine line between getting them from credible and reliable sources versus those na more fear mongering, no, particularly in the topic of immunization, which is a very contentious topic sometimes, no, in some areas and in some stakeholder groups in the Philippines. So definitely just to echo nga rin, no, yung what Doc Migo mentioned, no, so peers, healthcare providers, parents and educators in schools. So yun yung isang malaking opportunity, no, na paglalimin yung relationships of each other and the knowledges of each other to influence ultimately children and their decision makers, which would be the parents, iba, and caregivers to get them immunized. And then so apart from that, so really putting the youth at the center of co-development. So for us, hindi na nice to have lang yung getting the perspectives of children and their insights and their real experiences. It is mandatory. So in our projects, child welfare, child protection. So ano talaga, involved at the design and planning stage pa lang yung mga bata na end users, no, of any material na gagamitin. So whether it's yun nga, a playbook. So we have an experience before with Save the Children, actually children with disabilities naman yung gustong end users, no, of Save the Children. But at the design stage pa lang, in-involve na yung mga children na to for them to be able to for us to be able also to get insights and the actual experiences, no, of the children. So for us, the only way that a communications campaign has a chance to be effective and successful is if we draw from their lived experiences and consider them as our message architects and evangelists as well. So yon, and then yung siguro yung isang additional pa, no, emphasizing lang yung sa parents. We've actually had an opportunity din before to work with USAID before in partnership with the Commission on Population. So ang laking bagay din kasi nung building the relationship between particularly adolescent children and their caregivers, no, or their guardians or their parents. So si Commission on Population before, we helped them with a campaign called Konektado Tayo, which was aimed at improving yung communication habits and practices, no, and building trust between parents and children. So that is, I think, another gap, no, that needs to be strengthened and deepened kasi yung exchange of sensitive information like preventing teenage pregnancies, HPV immunization, ASRH topics, dyan siya nagagaling. It will start at the household, diba? So I think isa yung communication strategy na kailangan nating ma-harness. So yun yung mga, for me, communication strategies that we have done before and what worked and we could further deepen. Thank you.
Thank you, Dav, for that. And maybe we can delve deeper on the aspect of putting youth at the center of the co-development that you mentioned a while ago. But now, perhaps let's go back to Dr. Alvin Isidoro. So, this question is addressed to you. What are the strategies employed by your municipality to communicate vaccine information? So we've heard about BHW mobilization, house-to-house campaigns, and community dialogue. So perhaps if you could elaborate on it further, po, Doc.
Well, right now we're using all kinds of IEC activities, but mostly through social media. But again, I like to reiterate that we sometimes we are not that eager in advocating or in promoting vaccination. Why? Because we don't have enough vaccine. We the reason why we don't have why we have low vaccine coverage is because the availability of vaccine is not that high. Um, uh, you see sometimes in school, they will supply around uh, for example 400, and supposedly that's for 200 kids. But later on, there will be order that okay, we use the next 200 as first dose, and we will try to find the vaccine for the second dose. Anyway, that's still 6 months. But sometimes here comes 6 months, and then there's no vaccine. So that's really a big challenge, a big question now to the parents that we are scheduled on this date for the second dose, but we have no vaccine. So that's really the challenge in having a wider coverage of vaccine. Now, if you will ask us what's the best strategy that we have, is using this target age group, you really can communicate them. You communicate them through the parents or through the teacher. But for that. So what we do is we do the strategy, the mother-daughter initiative, where when we screen the parents, screen the guardian for cervical cancer using DIA, then we advocate vaccination for their children o sa kanilang mga pamangkin o sa kanilang kapitbahay. So kasi it's not the kids that will decide it. It's the parent that will bring their children to the clinic for vaccination. And as I said kanina, ito yung age group kasi that yung health-seeking behavior is not good. Sometimes we do not see them in the clinic. They are not in the private clinics. They are not in the public health clinics. I think the earliest age that goes to the private clinic is the 2 years old. After that, wala na sila sa clinic. So the only way to communicate them, the only way to catch them again is through their parents. Okay, so that's the strategy that we do. We usually promote that whenever we have vaccine, we promote that through our outreach programs like the Puro Kalusugan, the Health Caravan, and but mostly is through communication with their parents.
Thank you po, Doc Alvin. So just a follow-up question lang po. No? So how does Las Bañas RHU adapt HPV vaccination messaging to fit local culture, language, and community dynamics?
I don't know, but I think we haven't encountered much problem on the cultural differences or beliefs on as a cause of their hesitancy, but it's more of the fear or the safety concern. It's more of the availability of the vaccine. I'll give you an example. Our target population of 9 to 14 years old is around 9,000 plus. Then we have 14 barangays. Now, if we receive, like for example, 400 doses of HPV vaccine divided by 2, so that's 200. How do you how do you distribute that into 14 barangays? Halimbawa, 200 divided by 14, so roughly around 10 to 20, 10 to 20 target children. Okay. Now the problem is, how do we announce that? How do you announce? Oh, we have vaccine. You go to the center for HPV vaccination. It's it's really hard for us to announce that. Why? Because paano kung dumugin kami? Paano kung magpuntahan sa amin yung mga bata at wala kang bigay? We only have 10 vaccines. We have only 20 vials, 20 doses. Then the next strategy that we do is, okay, midwife, BHW, look for girls 9 to 14 years old. Okay, they will gather children. Now the next problem is, pag nabalitaan niya ng other na hindi nakakuha, they will say, kakilala lang ang binabakunahan, kakilala lang ang nabibigyan ng bakuna. So it's really a challenge for us. It's really a problem for us. But when we have that very limited vaccine, sometimes, to be honest with you, sometimes it takes us time to strategize to get that vaccine out and give that vaccine to the recipient. Because we have to strategize on how we are going to give that without anybody telling us that, it's favoritism, ito lang yung mabigyan, bakit hindi ito in-announce, ganyan ba. So it's really it's really a balance for us. So hopefully DOH can do something about that. I know it's a problem of financial, and HPV is not the only problem. It's same with vaccine, the same with BCG, it's same with Hep B. It's not only HPV. Hopefully DOH can do about it. I think they have enough money for that. The DOH can have enough money for that. Thank you. Thanks.
Thank you for that, Doc. So, I think may mga question lang din po addressed to Dr. Migo on the chat box. So, I'll just pronounce it here. So, to Dr. Migo Mantaring, can DepEd Central Office produce additional items for school health? Because currently, the number of school health nurses and dentists are not enough to cover all the schools. Imagine, one nurse is handling 3 to 7 schools in Manila. In the provinces or even in Mega Manila, the problem is even bigger. School health cannot be felt, not visible, not available. There's no one in the school clinic. I'm a newbie in the school health, 1.4 years to be exact, and I have encountered lots of shortcomings. I have tried to be visible and be felt by my schools, by my learners, teachers, and parents and guardians. So, ang tanong ko ay, is there any way for DepEd Central Office to produce additional items for?
Yes, so that's really a felt problem, no? Na we really acknowledge na the capacity of DepEd for the delivery of school health services is really limited, given that the ratios of DepEd school health personnel are extremely large, no? And I think it mirrors the same challenges and problems at the community level as well, with those with the large population to healthcare worker ratios. But nevertheless, no, that what we're trying to explore how DepEd can be part of local health system, since it's not known nga to a lot that there is a health system